Diagnostic cardiac catheterization, December 2019. Indications. For initial diagnosis of complex congenital cardiac lesions, example, tetralogy failure with pulmonary atresia. Second indication, when other imaging studies are equivocal. Third, in whom hemodynamic assessment is critical. Example, to determine the size of left to right shunt in borderline cases. Fourth, between stages of repair of complex CHT, example, hypoplastic left heart or right heart syndrome. Fifth, for long-term surveillance of patients with complex CHT. Example, after Fontan palliation for single ventricle. Sixth, for myocardial biopsy in the diagnosis of cardiomyopathy or on screening for cardiac rejection after the transplantation. Seventh, for electrophysiological study in the case of cardiac arrhythmias. Anesthesia should be conscious sedation or low-level anesthesia that is only routinely used to keep the patient as close to the basal state as possible. If general anesthesia is required, anesthetic agent should be carefully chosen to avoid severe depression. The center is to be performed in a center with pediatric cardiovascular surgical team. In the event, an immediate operation may be needed. Environment. To be done in a thermally neutral environment, be prepared to treat quickly for hypothermia, hyperglycemia, acidosis, or excessive blood loss. Procedure. Entry point. Under fluoroscopic guidance, the catheter is passed to the heart percutaneously via femoral or jugular vein. Assessment of left side of the heart. If foramen ovale is patent, we can assess via patent foramen ovale. Or if it is closed, we can enter via retrogradely catheter via femoral artery or via transarterial septum puncture. Or if ASD or VSD is there, we can see through that also. What are the parameters assessed? Shunt volume. By obtaining blood samples for measuring oxygen saturation in each cardiac chamber or blood vessel, so that each chamber's blood oxygen is different, that will show whether there is shunt present or not. Delineation of cardiac and vascular structures by injecting radio-opaque contrast. Cardiac output is measured by a catheter with thermosensor tip via thermodilution. Pressure is measured and it is used for calculating gradients, septal defects of valves and valve areas. Also, sophisticated indices like first derivative of left ventricular pressure dV by dt by catheters with pressure transducer tip and pressure volume loops by conductance catheters. But these values are almost exclusively used in research studies. Thank you.